Hey, Mike. Wait. I'm going to start it.
All right, guys, before we go in this dentist's office, I'm going to have our medical tourism guru, Johnny, tell us exactly where we are, the building actually. Where are we right now?
We're in Clínica Santana in beautiful country of Costa Rica.
Yes. And this is, we're in, did you say Santa Ana?
Santa Ana.
Okay, it's not too far from San Jose, right?
Right, it's not too far from San Jose. It's less than 20 minutes away from a major airport. And this is one of the latest attractions. This is kind of like the Beverly Hills in Costa Rica.
Yeah, so this is, I thought this was going to be smaller. This is a pretty big clinic. And so what's here? What's in this clinic before we go in this?
This clinic has more than 30 specialties, but it's actually not just a clinic. This is a small hospital that has its own helipad. It also has its own laboratory, its own pharmacy, its own emergency services. It has a lot of facilities.
You know what I like about it coming up here? We're not like in the middle of San Jose with all the traffic. It's like this is more of a...
No, you don't have none of that.
You want to come here, not to that...
Exactly. You have less congestion. There's no traffic, and everybody, as you can see, it's very clean, very well uptake. So
and not people running around crazy like they do at the other hospitals.
It's not like that.
So guys, we're getting ready to go into a dentist's office right now, actually.
Let's do it.
Let's do it.
Hello. Morning.
Hi.
How are
Hola.
you?
Buenos
Hola,
dias.
buenos días.
So we're walking into Oris Dental. This is one of the facilities, out of the 33 facilities that I have, but this facility...
You mean 33 in Costa Rica?
Yes.
So obviously everywhere.
Yes. But what's unique about this facility is that it's personalized. They're going to take the time, because it does only have 2 chairs, but when you're here, it's about you.
Oh, well, that's good. What about English?
English is not a problem. Is there a problem with English?
It's not a problem.
Oh, listen to that English.
I'm not a native language English, but I can talk to you, communicate to you, and give you all the...
Can you take care of me?
I can take
Okay, that's
care
what's
of
important,
you.
right? You know what, if you can share a little bit about when a patient comes in, what the process is.
Okay, first of all, I receive you and do all the things about
Your medical
appointment,
history,
yes,
information, yes.
exactly. Then the second step is our
Oh, wow.
articles
It's like a spaceship.
It's a spaceship. It's in Costa Rica.
It says all patients.
Tell me about the spaceship.
These take panoramics, cephalometrics, and 3D X-ray.
Go ahead.
While you're talking.
3D pictures, okay.
Yes.
So why is the 3D pictures important?
It is important because give us predictable treatments, and
You want to be correct. You want to make sure that what you're
Yes.
providing is exactly right, not a guess.
yes, this software brings to intraoral camera and let us to take pictures about all the things that
are happening inside.
inside.
So
the
do
camera.
you do a lot of gringos here, or people
Yeah.
from the U.S.,
Yes,
Canada, wherever?
Of course,
Right?
Canada, U.S., Chinese,
Europe.
Indians.
Everybody from the country.
Yes.
You know what? Show us about where the crowns are done.
Okay. Can
So this is all the latest equipment,
Yes.
obviously. Because people, I think a lot of people, if they're not familiar, they kind of think that, maybe this is older stuff, or,
yes,
I wanna-
we do cameras with CAD/CAM system.
Mhm.
Well, we scan people or patients with this intraoral scan. So in this software, we can make some models, virtual models of your mouth, your teeth. So we can do crowns, veneers, like this one.
Oh, wow.
And then we can scan your mouth, design some
That's crazy.
veneers,
Yeah.
inlays, onlays, crowns, bridges, and then we can make it.
It even picks up how yellow your teeth are.
You know
Come
what?
with me. You can come with me.
So is this a one-stop play? Everything can be done here. You don't have to go to another building to.
2 hours with you can go out with your
So-
crown in 2 hours. In this machine, we can mill your crown in little blocks, ceramic blocks,
Oh wow!
and then
So that turns into a tooth.
yes, of course. And then
What is that? Is that like res? What is
Ceramic.
that?
this is ceramic. Like there are so many materials like silicone, ceramics, resins, and this one is a match or of resin and ceramic. It calls feldespato.
Well, I
No,
just
she's saying all this.
I just called it tooth.
It's a tooth.
It's a tooth.
You know, this might be a crazy, or maybe it's a stupid question. Is there budget? Can you like get? You know, like is there different types of tooth? Like, well, this one's $1,000, and but if you don't have the $1,000, we also have a $800 one. Or
There's
something.
actually three types. So you can get the zirconium, you get the different types, but it's more based on the person, what they're comfortable with, and the options are always shared prior to the procedure being done. So you know your prices up front.
Do people still do dentures?
Yes.
Is that still a thing?
Yes.
Oh, I thought maybe it
It's
moved. Maybe,
changed.
maybe yeah,
Start
moved
looking
to-
into it now.
I know.
You're gonna need it.
Come in here and go talk to the doctor. Well,
Oh, there he is, right there. Oh my gosh, waiting in the wings.
Doc.
So how long have you been here practicing here?
Here, 2 years now. Yeah, all the clinic is brand new. All the equipments are from Germany. It's from Dance Barcelona. As Stephanie showed us, we can make right here, the 3D image, and then we can see all the things here in the chair. We can see the 3D here.
So Mike,
Quite
this
clear.
is what's unique about this, is that the doctor is interacting with you, the patient, showing you exactly what's going on.
When they're doing it?
When they're doing it at that moment. Now she shares with you what's going to be done, where it's going to be placed.
That dude's in trouble.
Yeah.
No, right now he is fine because we now he had the implants.
So how long would this person? So he comes in, you take all the information, do the preliminary.
Yeah.
How long is he going to be here? Is he here coming for 2 weeks? Is it just 1 day? Is it?
It depends of the treatment, right? But
Okay, so this guy here.
this guy 1 week. We start first the treatment planning. We do all the X-ray, analyze and decide what we want to do. Put the implants in the second appointment. After that, we put a screw retained implant prosthesis, and he can go to the States and came back 4 months later to put the final restoration.
Is there ever talk between a doctor in the United States and like you? Would his dent? You know what I mean? Is there?
that you would talk to the receptionist. In the States, you would talk to the receptionist. She would take care of you because you're going to talk to the doctor maybe 15, 20 minutes. Here, the doctors are personal. They're going to come to you, and you can even get their number. But uniquely about why this treatment is important is because the 10 days is not just for putting the implants in, it's also to take care of the patient. Their infections could happen. The doctor's here to take care of it.
Right.
Because the last thing you want to do is get your implants done, leave 2-3 days later, and then an infection shows up 3 or 4 days later.
Right.
So that's something unique that they try to make sure when you go in, whether you choose us or somebody else, leave yourself ample amount of time. So if an infection does happen, it can happen anywhere, that you have time to take care of it.
Is it still true that the cost is basically, obviously it does depend, about 1/3 of it would be in the States?
It's usually between, now a little bit different, is between 40 and 60% depending on who you go to.
Well, that's still huge. That's why people come here. That 40-60% is big.
But sometimes cost is important, but quality is even more important, and then people are taken care of. Because if you get it done in a facility, you need to know where you're going because a referral is just a referral. This is an actual facility that's going to stand behind the product. So the doctor, if he implants this, the implants are guaranteed for life. So if they fail, you come back and do it again.
Oh, really? Guaranteed for life?
Guaranteed for life.
Oh, wow.
Nice.
Doc, tell us a little bit about why the two facilities, how this digital helps you speed the process up, and what you've seen that it's helped.
Yeah, it's beautiful because for the patient and for us, we can see everything here. How is the bone, the quality of the bone when we are talking about implants. So the patient can, in real time and at the same time like us, see all the bone quality and decide the treatment planning, and all the things help us to give you what do you need real. So that is important for us and for the patient, right? And then we have all the technology to make predictable restoration, because all the things are digital.
They're not guessing. They're not guessing.
What do you see most of? Is it mostly implants, people from the States, or is it like veneers, or I don't know?
Yeah, both implants and veneers. Yeah, you know, someone's
Designs.
yeah, they're looking for function, but also for aesthetics.
Right.
Yeah, right. And we can give both here. That's for us the most important thing: function, but also aesthetics.
I like the fact that it's personal, and B, I only have to come here, and I don't have to go get an X-ray over there and bring it over here.
We manage all the process, right? X-rays, the treatment, the surgery, and after that, we also manage the lab part. You know, also in normal clinics, you take an impression, it goes to another place to make the restoration, the crowns. The process is here. So we manage the quality and what materials we are doing or using. You know, the brands. There's different brands from India, China, but we use only high quality. The United States or Germany, Europe, we like to use the best. We're giving you the best implants and the best material for your crowns or veneers or everything.
Well, Doc, thank you for taking the time with us here today with Michael. We wanted you guys to have a perspective of coming here, visiting, not just us saying, but we're here so you can see for yourself what can be in the future.
Yeah, I want people to see that. I wanted to do this visual so they can go, yes, it is modern. Yes, it is this, this, and this. Because I think some people in their heads get this crazy idea of Costa Rica, another country. Maybe, is it third world? What,
Well,
I want them to see the face of this.
Last week we have a guy from California, and when he sit in that chair, he said, "Wow, I never been in a clinic in the state, never like this."
Right. Actually, I like these right here. Look at
We
that.
like it, and he loves the experience. We like to talk about Ori's experience that is personal,
Right.
from the beginning to the end.
That's great, man. Thanks a lot. Appreciate it. All right, guys, we got about 10 more places to go with our medical dental tourism guru Johnny. So we'll see you in the next video. I'm Michael Allen. That's D'Angelo. That's the doc, and we know him. We don't want to give him too much play. All right, good. Thanks.
Thank you.